So, shall I start?
Yep.
Hi everyone, welcome and thank you for coming to this event. It's obviously a really important topic. It's very oversubscribed. We're booked up very, very quickly. I think that people realise that although there's been a lot of talk during the pandemic about what's happened to certain groups, under fives have been largely left out of the equation, haven't been talked about so much. We've got a great speakers, research from Public Health Scotland, and a chance for discussion afterwards. The event's being recorded and will be available afterwards. There were quite a few people who couldn't come, so that'd be really helpful. And we're also planning to do a short report on the key issues, on what people say, whether there are any particular recommendations for action. So some brief housekeeping. I'm sure everybody's probably very used to this strange way of interacting at the minute, but just to go through it again. It's a real shame not to be able to see everybody's faces and to see you all here, but we've asked people to turn off their videos and to mute for the duration of the speaker session. I think, but I'm not techie enough to know that it's something to do with bandwidth and making sure that everything keeps going. What you could do, which would be really nice, is just to put in the chat who you are and where you've come from, and then people get some idea who else is here. We will be putting later, we'll have breakout sessions and we will put the questions in the chat, and the facilitators also have them for the breakout room. We'll also be putting evaluation in the chat a couple of times, and that would be really useful to us if you could feedback on how you found this session. If you don't know, the chat is at the bottom of your screen. If you click on the chat, it will come up down the side. You'll be able to see any chat and any questions. There will be time. We've made it very tight for time because we wanted to pack a lot in. So if you put questions in the chat, we'll try and get through as many of them as we can, but there's not a great deal of opportunity for chat. So I'll just say a little bit about with Parenting Across Scotland, myself and Alison Clancy. We're a partnership of organisations working on parenting and issues that affect parents in Scotland. We've been around since 2004. Partnership of different organisations, so Aberdeen, Children in Scotland, Contact, Families Outside, One Parent Families Scotland, Relationship Scotland, Scottish Adoption, Scottish Families Affected by Alcohol and Drugs, and Scottish Commission on Learning Disability. And the intention is, by having all these organisations around the table, they can give some different aspects of family life or different issues that affect families. And obviously, quite often there's some common issues. One of the very common issues pre-pandemic was poverty, and since pandemic struck, that has been even more so the case. But then sometimes we'll find that there are some very different issues. We've got a website with a lot of information for parents and carers, and we do events, reports, and work a lot with government. We've been feeding back to government throughout this pandemic, talking about, for example, their messaging with Scottish Commission on Learning Disability, for example, said was very difficult for parents with learning disabilities. So we talked to them about what might work. I'm not going to say very much because, as I said, we're short for time and there's a lot of speakers who've got some, really good content and interesting things. I suppose I wanted to say a little bit about why under fives and what we're doing, why. I think these last 18 months have been hard for everybody. I don't think there's anybody that they haven't affected in some way or other. There's been a lot of attention on children at school and on teenagers, and rightly so, and on the whole exams debacle, the difficulties of homeschooling, the difficulties of having children at home and trying to work and so on. But I think there's been relatively little attention on the under fives. And actually, it's really difficult. Over this time, you know, mothers have given birth alone. Normally, perhaps they would have parents or friends who would come and help, health visitors would visit and so on. And while there's been health visitor contact, that hasn't been in person. Family support, I know the organisations we work with and many others have been fantastic in trying to make things work digitally or at the garden gate or whatever, but it's not the same as actually having somebody there to help. As everybody on this call, I'm sure knows, that time of being a baby and going to 5 is one of the times of the most rapid development in a child's life. And it's a time when they're very, very social. Their brains are developing. They need people around them for that language development, for that socialization. Anyone who's around a child that age just knows how much is happening. So I think children need other children. They need other adults. They're very social creatures. But I think the thing is, to most extent, so are parents. I mean, we did find when we were doing a project called Open Kindergartens, one of the biggest problems for parents was isolation. For many, that was affecting their mental health. That was pre-pandemic. But of course, the pandemic has only made it worse. And very often children have been at home with their parents. Normally, mums and dads and carers would be able to talk to other parents. And that, you know, there's a whole lot of things. Some of it is normalization, some of it's support. There's kind of things like saying, my baby's not sleeping, and you think it's you, or your baby's not eating. It's all about, you know, you're doing something wrong as a parent. And you talk to another parent and say, actually, neither's mine, you know, and you find that that's quite normal. Those little interactions are actually quite big interactions and quite important to think, to be able to talk about issues, to be able to go somewhere for support, to know where to go, to find what's available in the area. I think all those things are really important. And I think, yeah, anyways, Public Health Scotland has been doing research on right across the age spectrum, but we've asked them today to particularly concentrate on what's happened to the under 5s. So I'm going to go over to Debby Wason and ask Debby to speak and to give us the first. I should just say there's going to be Debby speaking, and then Lucy Thompson from Aberdeen University, who works on maternal health, and then Cheryl Brown. Debby's worked in Public Health Scotland since 2006, starting at NHS Ayrshire and Arran. Then she moved to NHS Health Scotland and now Public Health Scotland. Before that, she worked with a variety of international organisations such as Save the Children and UNICEF on maternal and child health in different countries around the world. Debby is currently a Principal Public Health Intelligence Advisor and Commissioner for Children and in Public Health Scotland. So over to Debby.
Hello everyone, I'm just trying to start my video. Is that okay? You can see me. And now I'm going to try and get up a screen, if I can. Let's have a look. Here we go. Right. Okay. Can everyone see that? Mm-hmm. That's okay. Great. Well, thank you, Claire, for that introduction. And it was really great to hear you talking about the under 5s and how important they were, because at Public Health Scotland, when we first went into lockdown last year, we started to look at all the different groups and what we knew about them and how, you know, COVID might affect them. And we began to feel there's a real gap here in looking at young children. And that was partly because I think there was an assumption that young children sort of were going to be fine. You know, they weren't affected by COVID badly. You know, they were unlikely to be hospitalized, etc. They were used to being at home. If they missed a bit of sort of, you know, early years or whatever, it didn't matter. They'd always catch up later. So actually, why were we worrying about young children? But some of us felt, no, we need to make sure they're all right. And so we began some research into this. So what I'm going to present today is largely from some research that we've done. I'll throw in a bit of sort of evidence from routine data that's collected, but I'm afraid there's going to be a lot missing. I'm not going to include anything on maternity or babies as such, although we do have stuff on that because of time. So I'm going to concentrate mostly on the research we did under something called KAIRIS. Now, KAIRIS was the named such because it stood for, I don't need to get this right, COVID and Early Years Resilience Impact Study. And it was because at the time we were in lockdown, the only thing we could really do was do a questionnaire. We put that out over social media and were amazed by the response. And it was for parents or carers of children aged 2 to 7. And we've done 2 rounds of that to date, and we're planning a 3rd. So in the first round, which was in July 2020, we had in fact about 15,000 responses, of which just over 11,000 were complete. And the second round we did in November, December time, and we had about 8,000 responses, of which about 5.5 were complete. And they were from all over Scotland. And there was a bit of bias in the data we got back, we knew, but we've been able to adjust for that.
Sorry, somebody has asked me, could you, I can't remember how you do it, click on share slideshow and from the beginning, and that will make the, I don't know where you do that, and that will make it bigger.
I thought I had done that. Have I not done that?
No, you
Start from big.
Sorry, Debbie, the problem is you started sharing, you started your slideshow after you started sharing your screen. What I find is better is if you come out of sharing, start your slideshow,
right, and
then that slideshow bit is the view you choose to share when you go to share screen. It's really annoying.
Right. Sorry. Well, okay, but then I can't get back into that. That's going to be problematic because I can't get back into
the other option
Zoom
is,
call.
the other option is that you don't use slideshow at all, and you just go into PowerPoint and just move through your slides in a way that's big enough that everybody can see them. That's certainly been my backup when I've had this problem. Okay,
I'll try that then. So let me go to share screen again and see. Apologies for this, people. So that's now shared, and people. So it's whether I can make it any bigger. Is it?
Yeah, if you just
can people not see that?
You can get rid. Yeah, we can see that. If you get rid of the bar at the side, if you just slide that all the way over, then that will at least make it a little bit bigger. Yeah, there.
Like that.
And then
Is that better?
Do the same for the notes bit at the bottom. I think, yeah.
Good job, someone knows what they're doing here. Is that better? Can I do it at the top?
Oh, and then the last thing, up at the top right, there's a little arrow that makes your menus go away. A little bit below that. But just below where your cursor is, along to the right. Do you see there's just a tiny little up arrow? Click that. Yeah. That's it. That'll do it.
Yeah. Is that all right? Okay. Sorry about that, folks. We do Teams, so I'm a bit of a Zoom novice. Anyway, yes. So this was the KAIRIS study, and yeah, we had a phenomenal response actually for an online survey that was quite long, and that people were, had just been contacted through social media. And it really, I think, showed the strength of feeling of parents of young children. So this, basically what we covered in KAIRIS was demographics about the children and the parents and their households. We looked at child health, at parental health and experience, at children's activities, the experience of trying to access children's services, and things around the experience of the pandemic, which was anything from sort of face coverings to feelings about going back to early years centres or school, etc. And so what I'm going to present is just a a few of the results from that, but there's a lot more to it in the various reports we've written. So one of the things we were very keen to do was to make sure that we used sort of objective validated tools where we could, rather than just relying on sort of parents' perceptions of things. So we used something called the SDQ, which is the Strengths and Difficulties Questionnaire for children. And this is used in a lot of schools, but it's also age appropriate. So there's ones for 2 to 3 year olds and 4 to 7 year olds. And we looked at it's a sort of 15 questions that parents have to ask about their child's behavior and the way they react to things. And from that, you can gauge, it's a sort of measure of social and emotional, it's a sort of assessment of their social and emotional status. So this one is the results for the 2 to 3 year olds. And I'm afraid it's going to be a bit death by graphs here, but anyway, sorry about that. The aim of really the SDQ is to be close to average. So you can see that in the left-hand columns. I'll explain the grey one in a minute. And if children are scoring high, slightly raised high or very high, that can be some cause for concern. Now, the grey bar is very important in close to average because in 2019, we were involved with the Scottish Government doing the baseline for the expansion of the ELC funded hours commitment from 600 to 1140. So we had a really good baseline we could use pre-pandemic to see, you know, how these young children were doing. And you can see, so the blue is round one, which is children back in July last year, just coming out of lockdown. And you can see that the numbers close to average, or the percentage close to average, was quite a bit below that grey bar, which was from 2019. And even by November, December time, when the children had been back in early years or in primary, it had risen, but it had not yet got back up to 2019 levels. And this is even more stark if you looked at the 4 to 7 year olds. They're quite a way below the grey, even after they've been back in ELC for 2 or 3 months. So why were these children still sort of, if you like, suffering some of these problems? Well, some of the answer might have been in the parents, because we know that children's well-being is inextricably linked with parents' well-being at this age. And we asked the parents to do something called the WEMWEBS, which is the Warwick Edinburgh Mental Health and Wellbeing Scale. And this is a measure of mental well-being. It's not a diagnostic tool for mental illness, it's a measure of well-being. And again, on the right-hand side is the SELC, that's the 2019 figure, and it's around 25. And that's a little bit lower than the general population, but we know that this is a very difficult time. When I say difficult, it's quite a stressful time for parents when their children are very young. But we can see that during the pandemic, parents' mental health really deteriorated. And in round one, it's at 20, and round two, 21. That may not sound a lot, but the total, it's out of a total of 35. So actually a drop of 5 points is quite a lot in parental well-being. And of course, some of this might have been caused by this, which is the income of families. And we saw that these families, in July, nearly half of them had seen a reduction in their income, and particularly those families that were already on low and medium incomes. And even by November, December, it was still down by over a third. And of those families who were on reduced income, 10% said they were struggling to feed their children. Now, one of the things that helps mitigate poor health and well-being is obviously access to the outside and playing with your mates. And here we can see that although the orange is round one this time, sorry, it's the wrong way around, but so round two, we can see that they got out far less than in round one. So in other words, in November, December, children were getting out far less than they were in July. And of course, if you remember last year, we had fantastic weather during lockdown, but by November, December, the weather's pretty bad. But I think the main concern is on the right-hand side, the question was whether children had been out at all in the previous week, and 15%, that's about 1 in 6, hadn't been out at all. So the children weren't going out as a way of sort of mitigating perhaps some of the issues they were facing. And of course, relationships were really important. So this was a question about how often children had spoken to family outside the home. And again, you can see that there was a sizable proportion who hadn't spoken to family outside the home. The next 2 slides actually are again about whether parents felt the relationships had improved or not. In fact, many parents did say that they felt their relationships with their children had improved during lockdown. But when there was an important relationship out with the household, then that was more difficult. And this is children's relationships with, say, an absent parent or absent siblings. And you can see that although over half said they reckon it was about the same, there's 38% who said they felt that it deteriorated, it got worse. But it's also important to note that some felt it had got better. A small minority actually felt it has got better. And similarly with grandparents, you can see again that many families felt that the relationship between their children and grandparents had deteriorated during the pandemic. And another issue that children were facing was that of bereavement, or is that of bereavement. And when we asked families, you can see here that 1 in 5 families said that they had suffered the bereavement of a close family member or a friend. So that means in any class of, say, 20 to 30 children, you're going to have 4 to 6 children who have actually experienced bereavement. And I should also just say that this wasn't just to do with COVID, it was also other causes. But of course, last year we had a high number of excess deaths from other causes because of the pressures on the health service, which we all know about. In terms also of children, if you like, the sort of new things that they were having to face, one of course was self-isolation. And here we see that actually nearly 1/3 of young children had to self-isolate, at least for a short time. And in fact, 1 in 6 had to self-isolate for at least 2 weeks. And many had said they'd had to self-isolate repeatedly because of COVID cropping up in schools and early years centres. This rather complex. So I'm going to move on now to just mention a bit about sort of whether families, how they could use services then, because that is a picture, if you like, of families where isolation is one of the key themes through all of that. Children not getting out, children having much less contact with family and friends, and undergoing some quite powerful events in their lives. So we asked this, I'm just representing this for context, it's a bit complicated, but this is about, we asked parents if they had needed to use the service or not. So this is those parents who said they hadn't not use the service, actually have contact with the service. And it's quite important to note the difference, because this was about if they wanted to speak to school staff or an early years worker or a GP or a health visitor. So it wasn't necessarily use as in like go into the school or go into the early years centre. It was about whether they would have liked support from a member of staff. So as you can see, the majority of parents felt they hadn't needed these services except for the school and childcare, which is why they're low bars. But if we look at then those who said they would have liked to have used the service, you can see that particularly in round 1, which is in the blue, many of them didn't manage to. So we've got there, for instance, parents who said they'd like to have spoken to a member of early years staff. Nearly 60% of them didn't manage to. And the reasons they often didn't manage to was because they didn't know how to get in touch, or they said they tried to get in touch but got lost in very complicated phone systems, or a variety of things like that, or they thought there wasn't any way of doing it. Also to note that nearly 75% said that they had wanted to use a dentist and hadn't managed to make contact with a dentist. So if we look specifically at schools and childcare, you can see that actually they did a pretty good job by round 2, and an increase in face-to-face contact, but still most of it was by online or through email or phone calls. But there was still quite a substantial minority, that's in the left, who didn't manage to speak to anyone, even though they wanted to. And it's a similar pattern with nursery or early years staff. And also health visitors, where we have a huge increase in face-to-face during in round 2, because obviously things had opened up in November and December, but there was still quite a substantial minority who didn't manage to get hold of their health visitor when they needed to. So I'm just going to move on as I sort of draw to a close a bit, because really what I really like, if you have chances in your group or whatever, to get some of your views and opinions on this, because this is really worrying us. This is use of the acute services by under 5s, and the line across the top is 0, or is what we would expect the use to be based on previous years. And so the blue bars are the drop in the use of these acute services. So the acute services are things like out of hours primary care, ED or A&E in old money, emergency admissions, NHS 24 or ambulance. And you can see there's been a massive drop in the use of these services. And it is far higher in the under 5s than in any other age group. And we don't really know why. And so it would be really interesting to hear your views. When we look at what children under 5 are coming into emergency departments or A&E for, the black dotted line is where we would expect it to be. And you can see that all of them are down. Now, we would expect respiratory infections, gastrointestinal, that sort of thing to be down because of the infection control measures. But we're seeing a big drop in trauma, injury and poisoning, which we're not sure why, in something called social circumstances, which is where families are perhaps really struggling and need some additional help. So we're not sure, and we're worried about this because we feel it may be that children aren't being brought to A&E when they really need to. So just to sort of sum up before I pass over to my colleagues, if you look at what's happened during the pandemic, we've seen a drop in household income, low parental well-being, low children's well-being, not all, but the majority, self-isolation, increased bereavement, more problems communicating with people outside, all of which we think lead to an increase in family stress. And again, one of the things that we'd really welcome ideas and opinions on and things is what we might do about that. So thanks very much, and I'll try and stop sharing my screen now if I manage to. Thank you.
Thank you, Debbie. I mean, that was absolutely fascinating. It's one of those things where I think that a lot of good research, when you read it, you find something out, but you have so many questions about it. And I think that absolutely shows there are so many questions that drop in acute services. One of the things that you mentioned towards the end that I was really interested in is speech and language, because I think that, children are if they're with their parents all the time, they get to that really cute stage, and it is very cute, where they've got all this language that their parents can understand but nobody else can, and that's usually remedied or changed to some extent by the interaction with other children, by other adults and so on. And I wonder what this is doing to it. So we're going to have a chance to hear from a couple more speakers, and then there will be that chance, and put any questions in the chat, but there will also be a chance to go into breakout rooms and really, as Debbie said, welcome your recommendations for what should happen next. The next person to speak is going to be Dr. Lucy Thompson. She's a Senior Research Fellow in the Centre for Rural Health at the University of Aberdeen. She's a research psychologist and public health specialist with several years' experience in applied health research in child and maternal mental health. Her published research includes work on early identification of neurodevelopmental problems and supporting parents in improving their relationships with their children. So over to Lucy.
Thanks, Claire. You've obviously all heard from me already with my my IT input. Let's see now if I can make it work for me. There's not a huge amount of point to me sharing slides other than I quite liked this picture that I found. I thought that was quite a good, I just put up a child, I think, in my little search for a picture, and this is what came up. So I thought it was quite illustrative. Now, I will apologise in advance because I have a 6-year-old just to my right out in the garden having the best fun with water and sunshine and all sorts. So there may be squeals from time to time. I shall do my best not to get distracted. So let's crack on with, there was just a few reflections that I had based on the findings that Debbie's presented to us today. So first of all, the most obvious thing to say that many of us have already, well, sorry, Claire has already articulated is thank you for doing this work. This is definitely an age group that has been particularly overlooked. I think when the pandemic first hit, those of us that work in the early years were very concerned about this being an overlooked group. And actually a few of us colleagues tried to have a piece published in one of the major medical journals stating exactly this, that we were concerned that this was going to be essentially a forgotten generation, and we couldn't get it published. At that time, I don't think it was just seen as important enough in the grand scheme of the global pandemic, which was a shame. I'm glad to see that things have changed since then, and I was really pleased to see that this research was conducted so quickly and so early in the life of the pandemic, especially because we were all living this. I'm always really impressed at people that were actually able to get it together, to pull together nice pieces of research at a time that was stressful for all of us. So I did a quick search, as well as, kind of my own experience like a year ago of feeling that this group was being overlooked. I thought I'll have a little bit of a look at the peer-reviewed literature, what's actually what research has been published on this issue of how the pandemic has impacted young children. And there's very little out there. I got over 100 papers coming back from one of the main medical databases. Very few, if any, had data on young children in the under 5s. There's some that reflect on previous pandemics, which is obviously useful for us. But it's important also to focus on the specifics of the pandemic that we're currently experiencing. There was one paper by Helen Cowie and Carrie-Anne Myers, which I can include the reference in the slides for when they're shared with you. And I thought that was a particularly useful paper that tried to take an overview based both on previous experience and what we know from the current pandemic as well. I think it's fair to say that the findings from Public Health Scotland and from other places as well leave us in no doubt that those who already faced additional challenges as families have been particularly disadvantaged by the pandemic. I think there's some interesting positives that have come out that have been alluded to already. Having a bit more time with our kids, for example, has potentially been beneficial. But overall, if you've already got significant challenges in your life, then this has probably made it a little bit more difficult. I suppose the main thing I wanted to concentrate on is maybe what we don't know yet. What are we missing from having a look at this? One of my concerns from the Kairos data was the Strengths and Difficulties Questionnaire. This is a questionnaire I know very well. I've been using it in research for the past 20 years or so. And I was aware that in the report it showed that because of the nature of some of the questions in the Strengths and Difficulties Questionnaire, those who hadn't had social contact in the preceding 2 weeks were not asked the Strengths and Difficulties Questionnaire questions. So the report is very good in acknowledging that this is a self-selected sample. It's not necessarily representative of all groups across Scotland. But this is one of the groups that I would be, from my line of work in mental health, particularly concerned about, is if young children haven't had any social contact in the preceding period before the survey took place, then I would expect those to be the children that I would be more concerned about. So it's a shame that we don't have any mental well-being data on those children specifically. Yeah, and sorry, I'm looking at my notes here. So I suppose that makes me think that it would be great to have a little bit more from administrative data sets, and that kind of turns me to look at health visiting and what we're able to get from that, which of course health visiting has been underutilized or has been less available due to the pandemic as well. So that's obviously going to have been compromised. Another big gap for me was, we've been talking about this webinar being about the under fives. It's really about the 2 to 5s. We haven't really been thinking about the babies, or that's not been the focus of this research. There is the Babies in Lockdown report, which I assume many of you are already familiar with, and I would urge you to look at it if you're not. It's a lovely report, really easy to read, and of course very much reflects the sort of findings that Public Health Scotland have got in their, have been presenting in their report. But yeah, I would definitely recommend having a look at that one. And then one of the other things that I started thinking about was contextualization. So Debbie, you talked about how, you know, if we're seeing this reduction in, or this looks like what looks like a reduction in well-being for young children, there's also an association there between parents' reduction in mental well-being as well. And I think it's quite difficult to piece some of these things together when with a report like this, which is so data heavy, which is useful and important. How do we link together these various graphs and elements of data into real kind of lived stories for people? So what about qualitative accounts? I think it's something that I really liked from the Babies in Lockdown report, is not only did it present quite a few quotations about, you know, people's lived experiences, but also in giving those quotations underneath, it also characterized the demographic characteristics of that respondent. So you weren't just aware that this was a parent that was providing this particular quotation, you were also able to say that what age group the parent was in, what sort of, how many children they had, whether they were in a relationship or not, what sort of family income they had. So it just brought it to life a little bit. And whilst there's a limit to what big surveys like this can do, I think that's something we need to now work on, is get a bit more about the kind of lived experience and cross-referencing the different risk factors. So I have to say, the kind of the nerdy researcher part of me was wondering about statistical significance, which is referred to in the report in the longer versions. But also about, let's do some multivariable analyses. We know that there's problems here, we know that there's problems there. What if we put them all into a big pot and figure out, you know, what's predictive of what else, and so forth. So there's a way that we can do that in a less scary way, is probably the best way to put it, in that we can actually, it's about the contact that we have, or that practitioners have with families, and what we learn from our own experiences of actually piecing together these various elements and what it means for any individual family. And one of the things that really concerns me about all the research that's published so far, because of course it takes a long time to work through this research, get it written up and get it published. One of the biggest questions I have is, what about winter lockdown? I don't know about other people's experiences, but certainly the experience of my family and those around about me is that winter lockdown was particularly difficult, especially from a mental well-being point of view. I think it surprised us because we thought we'd done this before. We thought we knew how to do it. I think, yeah, many of the people I've spoken to found it particularly challenging. So I'm assuming there is ongoing work from a range of places looking at people's experiences during that period, but I'd be really keen to see a bit of a focus on that as well. So yes, I realize I've focused on what we might be missing, but I think it's quite important to kind of place some of this kind of data heavy research into a bigger picture and think about what is the context around this, and then what can we do about it. I think what reports like this and similar reports have done is it's shown us that the problems that are already there are made worse, and there may be some specific aspects that are appropriate to this pandemic. But on the whole, this is about problems we already knew about actually just being exacerbated. So we have an opportunity here potentially to address inequalities and problems that were already there, but we've got a kind of a call to arms going on. The Babies in Lockdown report certainly does that as part of its recommendations, is saying, right, well, we've got an opportunity here. Let's ask these questions, let's push for funding, and let's push for specific sort of funding that we know is likely to actually make a difference to families. I would also, from my point of view as a researcher, push for certain types of research, which is obviously what I've been alluding to throughout what I've been saying so far. Let's make the best use of administrative data sets. I was aware, one of the things I picked up from the presentation was one of the measures of service use was about whether people felt they needed to access a service or not. So health visiting, for example, whether people were able to access when they felt they needed to. One of the principles of health visiting is progressive universalism, where we are aware that families can drift in and out of a position, or very rapidly come in and out of a position of additional needs. And that's why we have a universal health visiting service. So I don't think families are necessarily always going to be in a position to know whether contact with a health visitor is going to be a useful thing for them or not. So I think the effect of the lack of contact, not just from a point of perceived need from the family's point of view, but from the perception of the programme that is supposed to have been put in place and naturally had to be scaled back significantly last year. So I would like to see some more research based on administrative data sets and lots of other things that can tell us about what people's experiences were like. So yeah, I think that's everything that I wanted to cover.
Thanks, Lucy. That was really interesting and really good kind of overview of where we are. I thought it was particularly interesting in a sense, the into lockdown and what's happening there, because I think it was probably much harder for all of us in winter lockdown. I was very struck at one point by, a lot of encouragement from Scottish Government and others for people to get outside and play. And of course, when the weather's rubbish and so on, you actually feel much, much less like playing or getting out to play. And I think what we sometimes forget, that, we're talking about poverty and we say, oh yeah, kids need to be kitted out with their wetsuits. And that's all very well, but actually, if parents themselves haven't got a good raincoat and waterproof shoes, then they're much less likely to take their children out. So I think there's something there about the whole thing about poverty. And the next person to speak is going to be Cheryl Brown from Midlothian Share Start. And Midlothian Share Start are a voluntary organisation that's been going for a long time. They have a number of hubs in Midlothian, and they acted as hubs during the pandemic. So they had both children coming into the hubs, but also delivered a wide range of services. They, did food parcels. They kept in touch with families. So Cheryl's going to give us a bit of the direct experience with families. And what I'm going to do after that is go straight into the breakout rooms so that we actually get a chance for the discussion and for people's own experiences and to get some of those recommendations about what would help, and then do the questions right at the end, because I just feel it's so important to get your opinions. There's so many people here that have got very good experience, so that we could actually get recommendations for what should be happening. But I'll hand over to Cheryl. If you could keep brief as well, because as usual, time is of the essence. Thank you.
Hi, Claire. Thank you. Hi, everyone. Claire's asked me to speak a little bit about our practice and what's been happening over the last year during COVID and how it resonates with the work that has been done through this research. I'm going to try and share my slides, and I'm hoping that it goes okay. So if you have any problems being able to see that, just let me know. So Midlothian Share Start is, as the title suggests, based in Midlothian. And our aim at Midlothian Start is to build the very best beginnings for children. We work with children and families from the age of 0 through to 12, but predominantly work with children in the 0 to 3 age brackets. We offer a range of services, and generally our services have been aimed at working with both parents and child, and really looking at that attachment relationship. And trying to ensure that that parent-infant relationship is as strong as it can possibly be. And in order to do that, we've focused on providing services to families to ensure that they're in a position to be able to support their young children, and have therefore offered a range of services like therapeutic services, family learning services, parenting courses, but it's all been based on having parents being able to come into our 6 family learning centres that we run across Midlothian. Unfortunately, when COVID hit, it meant that that relationship that we had strived for so many years, and it's been the past 20 years we've been working in the community, suddenly meant we could no longer work directly with parents in our centres. And we had to become more creative in the ways in which we try to engage families. As Claire said, during lockdown, we closed for 2 weeks just at lockdown, and then immediately reopened to offer hub spaces to the most vulnerable children that we work with. 52% of the children we work with come from Scottish Index of Deprivation areas 1, 2, and 3. So they're very affected by poverty. And also many of the families we work with have parents who have mental health issues or suffered from depression and a range of mental health issues prior to lockdown, which were then exacerbated in this period. Overall, in the course of the year, we worked with 330 children. And so you can see that by working with 90 children in lockdown, there were a large number of children who in that first 3-month period didn't have access to our services. At the end of lockdown, we had a whole range of children return to us. During lockdown, we were supporting children who did not normally use our services. So it was an opportunity as well to be able to engage with some other families that perhaps hadn't utilized our services before. But the difficulty we experienced, one of the issues was that as a service which has a theoretical base based on attachment theory, we found that we were having parents just having to hand over very young children at the door and walk away. Normally, a key element of our work would be ensuring smooth transitions for children when they move onto our services or into our services. And yet we weren't able to have parents come in and help with the settling in period. And we wonder about the impact of this on these very young babies, because we do work with some young babies as well. So during lockdown, we had to move the services to families from being direct face-to-face services in our centres to online services, offering activity bags, meeting families when we could in the park. And we found that during lockdown, families really engaged with us. They came online, they joined in sessions. And then once lockdown had ended, we had variable response from the families that we worked with. Some children had done really quite well, surprisingly well, whereas other children and families had really, really struggled. And then we managed to re-engage families in that period up until Christmas and started meeting some of the families in the park. But then the second lockdown hit. And what we found was that many of the parents who had engaged online in the first lockdown had really felt burnt out by online methods of engaging and didn't want to engage in this way of working. And we're saying, well, when you have a face-to-face service, then come back to us. And we found it to be a real struggle to engage. And I'm wondering how other services are finding. The families where we already had a relationship with and we were able to engage online, by having online groups, those families continue to have some social connection, because a key benefit from Midlothian Start over the years has been that opportunity to engage with their peers and experience that peer support. Whereas now, for many families, they didn't have that opportunity through this period. But for those who did, they continue to feel more connected, Whereas for many other families where they didn't have that, and some of our partnership agencies were reporting to me that they were struggling and are struggling at present to be able to engage some families. And we also have always, as an organization, really engaged well with dads. And we've found that that has become increasingly difficult over the period. When we look at the impact on child well-being, I had a review of our data from 2019 and found that approximately 24% of the children that we work with, we had well-being concerns. And these range from with the fact that their parents have mental health and issues, and we're just ensuring that the children are getting the support that they need, to domestic violence and other concerns. And this over lockdown period has increased to the state where we now have 30% of our children who we're concerned about. Comparing our data of children on the Child Protection Register across the years indicated that actually it seemed to be slightly less, but our numbers are so small, so it's really hard to be able to tell if that's indicative of a wider picture. So it'd be really interesting to see what the situation is like generally across Scotland. But we've also had an increase in the number of looked after and accommodated children. And again, I'm not sure what the data is, and I really find the report really helpful, but it'd be interesting to see more data around the impact on the most vulnerable children. We have something that resonates with the report is we have had a huge increase in demand for sleep advice, something like a 2000% increase. We also know about the impact on reading and on language. Our local primary schools advise us that the literacy levels of the children in P1 are right down, but they are making really good gains. So again, it'd be interesting to see what the picture is across Scotland on that. And also issues in playgrounds with children who've been experiencing difficulty with emotional regulation and social skills through the 2 lockdowns. We have had some discussion around income. For us, a quarter of our families that we work with, because we work with families who are on low income, were referred to financial advice and benefited from that, with approximately 20% referred for emergency financial support over the period. As an organization, we provided a lot of support, and we were very grateful to many charitable organizations who provided direct support to families over the period. Families on universal credit benefited from a £20 increase per week over this period, but they now tell us that they're really concerned about the impact when this comes to an end, which will be at the end of September. We offer therapeutic services which include mindfulness, counseling, art therapy, and we've seen a huge rise in that over this last year. Again, we've also been fortunate in that there's been increased income for us to be able to increase the amount of our therapeutic intervention over the past year. But my concern will be that many of these services have been short-term in nature, and there's no planning for longer-term opportunities to provide services to families. So one of my pleas to policymakers would be to take a more coordinated, longer-term approach to funding to ensure that services aren't just set up for the period of COVID and then withdrawn from families who then will be struggling to access the support that they need as we move forward. What we found with the counselling that we did offer, that the number of adults who present with significant risk on the core scale, which is the clinical outcomes in routine evaluation, that their scores had that many more families, 36% compared to 9% of those adults were presenting with significant risk. One of the issues we have had is the fact that we've had to provide our services for a large part of the time by online means and not able to offer face-to-face counselling. And 20% of the people have not been able to access that, which again speaks to the research where perhaps families that have not been able to access the support that they've needed over this period of time. But for us, one of the key methods of providing support is group work, and it has really been an impact for us that we have not been able to provide that over the last period. The other key element is that we've always provided our services through partnership working, and we've really noticed the impact on families where they have not been referred. We have seen a decrease. In the year previous, we had 613 referrals to 406 this last year. And that is partly because of burnout for some staff. The schools that would normally refer to us have just felt overwhelmed, and health visiting haven't necessarily had the opportunities to perhaps see as many of the families over the last period. But there has been a great willingness for partners to work in partnership. It's just made extremely difficult when you don't have that opportunity to have that face-to-face contact. And for children, like for instance, who require speech and language therapists have found it difficult to access early year settings on the whole over this last period. So it's made it really difficult for them to offer direct support and services as opposed to having to do it via working with early years practitioners. Certainly the things we see that are emerging, and it'll be really interesting to see what you are experiencing, are issues around social isolation, that burnouts have been online, and concerns now about coming out and mixing with other people. That increase in mental health and wellbeing concerns and increasing waiting lists at CAM services and what support will be available for them. The impact of poverty that we've already heard about, but what about the risk now presenting where families have got very used to that additional £20 a week and will have that withdrawn, and the potential for service reduction after all these additional services have been reduced. I'm sure there are many other aspects that you will have picked up from the reports from your own practice, and I'm looking forward to the discussion going forward. Thanks very much.
Hi, so back to me very briefly. Alison is going to put us all into breakout rooms. I'm just going to post the questions in the chat. No, that's not the right thing at all. Sorry. Need to put the questions in. Alison will put us into breakout rooms. There's a facilitator in each room, and there are two quite basic questions, which are basically, sorry, what surprised you or was of particular significance? Other issues from your own experience that weren't mentioned? What support to parents and carers to help their children as we move on? And we really hope that you will be able to give us some ideas, and we'll be putting this in the report back, feeding it back to Public Health Scotland, to government, and so on, so that we do hope it will make a difference to parents and their children. So here are the questions in the chat. And Alison, can you put us into breakout rooms now? muted again. I hope you've all had very good discussions in your breakout rooms. We've got a very short time left. I wonder if, hopefully, if a few of you might be able to stay on a bit longer, but if I could ask people to do quick reports back on their groups, very quick reports. Liz, could you say about your group? Liz, sorry.
Yeah, of course. So in terms of the first part of the question, just questioning around particular significances or any other issues that weren't maybe raised, I think the thing that we all kind of were quite surprised by was some of the statistics that Debbie was sharing with regard to changes to access to acute services over the last wee while, and I think we had some wonderings around what that might have been, but I think largely we were acknowledging the message was very much during both lockdowns, but particularly the first one, don't go anywhere, you know, basically don't go out. And so, you know, has that caused more of a risk in that respect, but parents are opting not to access these services. Other issues I think that people felt perhaps had not raised were really around anxiety, an increase in anxiety for parents and for little ones as well. And I guess that kind of linked into some of the recommendations that we made. There was also wonderings around hidden information, so, you know, information that we don't yet know. And one of the things was highlighted there, stress and dangers maybe related to domestic violence or violence within homes that's likely to have been unexposed. One of the things that I thought was really interesting, and I hope you don't mind me picking on you, but Orkney are now at level 0. And we're just highlighting the fact that there's been a rise in referrals to social work support services. And I think that's quite significant and one to watch. Online burnout, we mentioned that a little bit as well, and acknowledging that, you know, for young people and children, when they're choosing to use technology, that's one thing, but when there's no choice, and I think this goes down for staff and learners, you know, facilitators, all of us, we've had to change what we're doing so quickly, and I think that's had an impact on everyone, parents and young children also. So just very quickly in terms of recommendations, mental health support I think is probably the primary one based in the community. The perinatal support, I mean, really just I think overall increase, you know, understanding that there is an increase in support there required, primarily related to mental health concerns. There was also mentioning around, you know, the fact that we've become so acutely aware of being safe and keeping distance and not touching and not being close to people, and how is that going to look as we transfer back to normality, and is there going to be anxieties around that, and if so, you know, what do we do with that and how can we best support? So I guess in terms of the supports, predominantly it's around mental health challenges, and also early literacy, because we're acknowledging that that's had quite an impact on our children's learning, and that's the area that people felt we needed to really focus on.
Certainly things that I was hearing there as well in our group. I mean, people talked very much there about mental health, about we need more research on the lower income groups. We know it's impacted on them more. Digital exclusion being an issue, but equally the fact that digital is all we have been forced on us, or, you know, it's not what we want, we need more in person. Social isolation and the young parents particularly, and impact on attachment and so on. People were also saying about the pressure on the media and the pressure on the NHS, and, you know, what had been put forward really put people off going, I guess, and the anxiety over possibly catching COVID. We had a paediatrician in our group who was talking about that there had been, you know, this drop, huge drop in the reconfigured services, but nobody came. I'm sort of not saying that correctly, but then as things opened up, there was a massive increase, and particularly in child protection cases, mental health, eating disorders, and self-harm. In terms of our recommendation, it was to ask parents what they want really and what would help, and people need more online contact. So perhaps if I can ask Sally, because I can see you there. It's quite funny who you can see and who you can't. So you just
I know. Hi, yeah, just quickly. So our group, no particular surprises for what was heard in the presentations. We talked a little bit about the difference for working parents and carers and non-working. So some of the pressures on working parents who are working from home and what that meant for the sort of family dynamic and support for their children. So kind of talking about parents who really wanted to be furloughed. We spoke a little bit about relationships and developing relationships with services. So just hearing about the second lockdown where there was maybe new families to a service and they didn't know the practitioners and some of the challenges that created if the existing relationship wasn't already there. So and we spoke a little bit about pressures on families with children with additional support needs. So some of the things that were highlighted in the presentations around about just that sense of isolation and not having the support required. In terms of what support parents and carers need now, so there was a call for us to be radical and more imaginative. We talked about the need, so the definite need in terms of the provision of services, the need to continue to have that online offer, but with the recognition that it really doesn't work for some people. So not only in terms of data and confidence, there is, so sort of blended approach in terms of support and services. And then we started to talk through what the enablers of that are. We talked about continue to make better use of the outdoors. So not just in terms of the sort of play model, but in terms of access to services and support for families. And then finally, we talked about funding in the third sector. So just the need to stop short-term funding, just so in order to support families, particularly for third sector provided services, longer term funding model is really the only way forward, and I certainly strongly support that. So yeah, I think that was about us.
Thank you, Sally. And a couple more, sorry, we are running over time a bit, but it's great to actually hear these things. So if I can ask Joanne and then Hannah. I'll ask Joanne first and then.
Yeah, lots of the same issues coming up for us. To kick off, there was kind of acknowledgement of the incredible resilience shown by many children and families despite the kind of difficulties, but also a real pressing point was that invisibility of under twos and them just not being able to gauge just how well they were responding or otherwise, because they were just largely cut off from our kind of universal services. And questions arose around what was the impact of the kind of shift in the health visiting offer and how did that translate across regions? What was the variability? Some really positive stories about smooth transitions online, and others just being as kind of limited as a text message. But none of that nuance comes out in the data. So how do we really understand what the experience were for women themselves? Because there's a lot of really kind of harrowing stories about very limited contact. Also, how do we define critical services? Our supermarket staff were all there all day, every day, yet our health visitors were withdrawn in many cases, social workers unable to make contact. Should we have a similar experience of lockdown again? Can we ensure that these critical services are there and visible and able to support women and families? And we also touched on third sector funding as well. And it was recognised that there was a big injection of funding, kind of ongoing emergency funding into the system to try and keep families afloat. without a kind of longer term financial resourcing strategy, it's possible that these families could just fall off a cliff edge when that money is no longer around. And what is the thinking being done to kind of address some of those challenges? So I would just say, in summing up, in terms of what was missing, we had very kind of harrowing experience of a mother herself who felt highly socially isolated, no support, the support networks were drawn, all the things that you would consider as to be a red flag for a health visit, for example. Parents were forced into that situation, not to make contact, not to engage, not to attend groups. How can we ensure those support networks are maintained? Also, we need to understand a lot more about vulnerable families, low-income groups, and what are their experiences, because the Public Health Scotland data didn't really provide a kind of spotlight on their distinct and often compounded experiences of lockdown.
Okay, thank you, Joanna. Or Joanne, sorry. That's really useful and really helpful. I mean, I think from third sector funding seems to be coming through quite a lot, but also I think really the impact, we know that, I mean, I think Debbie started off by saying, you know, so it wasn't that the pandemic caused the problems to some extent, some of them obviously did, but there were existing problems that this really exacerbated, and particularly the inequality in our society and the fact that some people just don't have enough money to put food on the table, to pay their bills and so on. That was the case before, but it's got worse, and it's not something that we can ignore because it's got a very definite impact on the health of our young children, but actually on the health of our society. Anyway, enough of me doing a little bit of a rant. I'll maybe pass over to Hannah from the last group to wind up, and then after that will be, if you could fill in your evaluation. We've got a very, very short evaluation, so please fill it in, and we'll be finishing up, but we'll be doing a report and we will be coming back to you. And you know, there's so much to unpick and discuss that maybe we'll be doing something else on this. So anyway, Hannah.
I'll be brief, Claire, and just mention things that perhaps came from our group that would supplement the points that have come up already. It was a really interesting group in terms of people coming, sort of reflecting on well-being from different backgrounds and different sectors. Questions, and some questions were around intimate partner violence and the concern of that, and sort of reflections on whether there could be more exploration of just how those concerns over the last year. In relation to that, child protection cases, how many of them, and have they been missed? And so also the concern of parents not attending A&E because of the fear element, and reflecting on that, the fear and how that has perhaps been encapsulated differently in the first lockdown compared to the second one, thinking about the mentioning of the winter lockdown being that much harder, and considering whether, sort of in relation to the second question, is, are there learnings around fear and the experience of the winter lockdown as we come into the possibility of another lockdown this coming winter, and an increase in childbirth trauma and the impact of that in terms of the impact on the parents, and then just the beginnings of family life for parents when the likelihood of traumatic birth experiences being that much greater in the circumstances. So a lot more childbirth in a lot more home births and car park, births in car parks. Home births aren't necessarily traumatic, but there have been a lot of traumatic births in homes, and increasing that, an impact on anxiety of that, and the impact of that on relationships. So sort of concerns around, in terms of well-being, a focus on parents' relationships and the impact that that has on development in the early years. So yes, so also confidence to be able to trust in organisations when you're dropping a child off at the place, and the ability of the transparency within the organisations. It was an interesting discussion because there are examples of ways in which that has been very successful. There's been a lot of transparency and almost an increase in positive experience, not almost, but an increase in positive experiences for parents of dropping their children off at the door, as opposed to parents coming in. So some interesting things happening in that way. I'll stop there. But yeah, that's really just scary. So I apologise to the group if I've not touched on some more pertinent things. But that's a wee summary.
Yeah, so apologies, we've run over. We've learned a lot about running events, which is that there's a lot to say about the under fives. I'm sure there's a lot more to say, actually. There were some questions in the chat, and because we really don't have time, what I'm going to do is take those questions away and get back to Debbie and the other speakers. And when we come back to you, we'll send out the evaluation survey and, a quick, some quick after things, and that will be one of them. I'll come back with answers to people that had questions. But we will be doing a report, and we look forward to sending it out to you. And thank you all. I mean, I don't know, we're the ones that organised it. We asked the speakers, but I know that I've learned a lot today, and I've learned a lot from people in the room. I mean, it's been quite strange for us all being atomised, particularly for parents being atomised in these small rooms and small gatherings. Very difficult to come together like this, but actually it's been a great event for me, sort of seeing people from health visitors to doctors to people in government, and really getting a real broad cross section of what's happening. So thank you very much, and that will be us. We'll see you soon. Thanks a lot. Bye.